Hello everyone, my name is Sarah Obringer and I will be presenting today on sick sinus syndrome and some other syndromes for the cardiac system for my pathophysiology class today. Sick sinus syndrome describes a number of forms of cardiac impulse formation and intraatrial and AV conduction abnormalities. It is a result of total or subtotal destruction of the SA node, areas of nodule atrial discontinuity, inflammatory changes, degenerative changes, and pathological changes that can occur in the arterial walls. There are certain arrhythmias that can be associated with this. These include a sinus bradycardia, which is slow heart rate due to vagal stimulation or medications that can decrease the firing rate of the SA node and conduction through the AV node that would slow the heart. Prolonged sinus arrest, which is failure of the SA node to discharge and results in an irregular pulse. Sinus exit block, this is when the sinus node fails to depolarize the atria. There can also be combinations of SA and AV node conduction disturbances or alternating paroxysmal of rapid, regular, or irregular atrial tachyarrhythmias and periods of slow atrial and ventricular rates. Individuals with sick sinus syndrome are often asymptomatic. Common clinical manifestations are lightheadedness, dizziness, and syncope. The symptoms can also be related to bradyarrhythmias. People with sick sinus syndrome can experience palpitations that result from tachyarrhythmias and can be suggestive of the presence of bradycardia tachycardia syndrome. Some healthcare providers will use sick sinus syndrome to refer to bradycardia tachycardia syndrome. The bradycardia part of this syndrome is caused by disease of the sinus node, and the tachycardia is caused by paroxysmal atrial or junctional arrhythmias. Treatment for this syndrome frequently involves the implantation of a permanent pacemaker so that it can pace for the bradycardia, and also drug therapy is used to treat the tachycardia. Sick sinus syndrome can be associated with coronary artery disease, which is a disorder of myocardial blood flow due to stable or unstable coronary artery atherosclerotic plaques. It can also be associated with diseases of fibrosis, infective processes, certain drugs, and collagen vascular diseases, which is the inflammation of collagen around the joints, which can be like rheumatoid arthritis. In children, this syndrome is most common with congenital heart defects that can potentially cause irregular rhythms in the child, and particularly after the child has a corrective cardiac surgery. Other syndromes in the cardiac system include short QT syndrome. This is associated with a short QT interval in an ECG. People are typically asymptomatic when they have short QT syndrome, but have a history of syncope. The history of syncope in the short QT interval in the ECG could help a healthcare provider distinguish the short QT syndrome from sick sinus syndrome. Brugada syndrome, this is characterized by ST segment elevation, right bundle branch block, and susceptibility to ventricular tachycardia. The cardiac events that typically occur during sleep or rest. This can distinguish it from a sick sinus syndrome. If a person that could potentially have Brugada syndrome or sick sinus syndrome is having these cardiac events while they're sleeping or at rest, then that would lean more to the Brugada syndrome, and it would help a healthcare provider to distinguish between the two. Another syndrome is acute coronary syndrome. This is an unstable angina, ST segment elevation, and this is also the disorder in blood flow due to stable or unstable atherosclerotic plaques. Biomarkers can be used for healthcare providers to help diagnose this. Some of these biomarkers include cardiac-specific troponin 1, troponin T, and creatine kinase MB. This can help distinguish whether somebody has an acute coronary syndrome or a sick sinus syndrome. Healthcare providers can look for these certain biomarkers to see if somebody has the acute coronary versus the sick sinus syndrome. Thank you for sitting through my presentation on sick sinus syndrome and some other syndromes of the cardiac system, and I hope that you learned some new information and also learned about some kinds of symptoms and signs that you can look for in case that you ever come across somebody that would have any of these. Thank you.